Good evening, friends. Welcome to the PANSIGHT webinar. So I assume I'm audible and the PowerPoint slide is visible. The topic is side effects. I always try to make the session interactive. And during the presentation, the interaction between you and me will be through the chat box only. And I'll be posing some simple, straightforward questions to get your response. The response will be either yes or no, or agree or disagree, or like that only. So somebody's microphone is unmuted. I can hear a noise. And Srimar Nairji, your microphone, please mute it. That is okay. Now it is muted. Okay, thank you. Now the first question. Have you ever heard a talk on side effects? Answer either yes. If it is yes, put Y in the chat box. No, put N, so that I'll get a clear understanding. Okay, Musamilu, no. Others also, please, because most of you, I don't know what you know and what you don't know. So Srimar Nairji, no. So I'm trying to make it as interesting and insightful for others. What about other people? I know Dr. Shaji Prabhan, he's a medical doctor, and Dr. Mohanlal, Dr. Jayachandran, they know what the side effects mean. So I understand that is, except the medical doctors, almost all of you don't have any good understanding about side effects. Purpose of today's talk, know the definition of side effects. Know the impact of side effects on our lives. Know how to prevent those side effects. There are many books on side effects. I have displayed few titles. And the third one shows side effects may vary. Side effects may vary. That means different people may experience different side effects. So it is not one size fits all. Is this clear? If it is clear, in the chat box put C. So side effects are not going to be the same for everybody. Some people may not experience any side effects. Is it clear? Yes. Thank you, Dr. Ramadevi ji and Musamili ji. Thank you. My talk is always based on FEQT. Facts, I'll be sharing facts. There's no point in giving a talk without showing the facts that would support the contents. Then experience. And most of you know that is, I started practicing medicine in 1974. So now it is 50 years, half a century. So the vast experience-based knowledge. Then few quotations. I'll be using quotes that are relevant, appropriate, and thought-provoking. And lastly, my own thoughts. I always share original ideas. I'm not a person who copies something from a book and paste in a PowerPoint slide. That anybody can do. Anybody can do. But I think that is my hobby and come up with some new thoughts and ideas. But always I will make sure that is whatever I'm sharing, my own thoughts are strongly supported by with facts. Side effect definition, there are two different definitions. First one, consequence or result of an action or a situation that is unexpected or unintended. The word consequence has a negative connotation. That means it creates a negative emotion, consequence. Result is usually positive. Side effect, second one, a symptom caused by medical treatment that is unwanted or unexpected. Somebody has unmuted, it seems. I'm hearing some noise. So in the medical treatment, suppose a person is taking a medicine for cholesterol, high cholesterol. And the high cholesterol itself won't produce any symptoms. That on the lab result shows, oh, cholesterol is high. And you take a medicine, now you get a muscle pain. So that is a side effect. That is an unwanted. Is this clear? These two are separate. One is medical, from medical angle. The other one is not based on medical angle. If it is clear, put C. These two, I'm going to share many examples. Some are connected with the medical profession. Yes, Rama Deviji, thank you. Some are not connected with the medical profession. So that is something, this talk will be more interesting, more insightful. Because some people, they immediately assume, oh, he's a doctor, he's going to talk about the side effects of medicine. No, more than that. There is a Tamil movie, Adukkum Mele. The repeat phrase was, Adukkum Mele. That is what? Newton's third law of motion. I'm sure that is almost all of you in this group are aware of that third law. For every action, there is an equal and opposite reaction. So earlier I said that side effect, the action, unintended, the consequence of it. Here in everyday life, there is slightly changed. This one, Newton's third law. That is, no action is without its side effects. American biologist Barry Commoner. What it means is, every action, whatever we do, it will have a side effect. Every action, I will explain everything with easily understandable real life examples. Then nobody will have any doubt. Side effects can be positive, that is favorable, or negative, unfavorable. A lot of bureaucratic rules were created a long time ago when there were different challenges, and they are now causing negative side effects. I'll give you a real life example. I'm sure that you will agree with me. Article 370 in the Constitution. There's a temporary provision. I use the word temporary provision. It was implemented on October 17, 1949. I'm not here to talk about politics at all. Some people, they immediately confuse politics. No, I'm talking about a fact. Article 370. And because of that, these side effects, negative side effects, people in other states of India, they cannot buy any land in Jammu, Kashmir. They may not be able to even apply for a job, get a job in Jammu, Kashmir. So that is it. Now, do you agree that the so-called that one article, lot of negative side effects, and when it was abrogated 3 years back, do you know the positive side effect of that action? Every action will have positive or negative action. In 2023, last year itself, nearly 2 crore tourists, they visited Kashmir, including our Srivamara Nair ji, who is here. He also went to Kashmir. 2 crores. I usually ask people, how many days did they spend and how much was the total expense? Most of the responses, 5 or 6 days, 50 to 60,000 rupees, including the travel expenses. Suppose the travel expenses, airfare, maybe say 10,000 rupees or 15,000 rupees. But they end up spending some nearly 35,000 rupees in the hotels, in the sightseeing and buying things and everything. So multiply that with 2 crores. Revenue generated by that abrogation of that one. Do you agree that Article 370, the negative impact, are you convinced? If you are convinced, you put a C, my dear friends. Because I am sharing real life examples. Are you convinced? Yes. Rama Devi ji, yes. Roy Cherianji, yes. I'm not talking about politics at all. Because if you listen to me with an open mind, then only you will be able to understand that I am sharing facts. The talk is about side effect. And about that particular, that constitution, that one, how it hurt. That is a negative effect. Thank you, Abaji. Good fortune has side effects. Martha Beck. I'm going to share a real incident and a real life example. Suppose, Abaji, listen to me carefully, and Shanmu Rajeshwari ji, listen to me carefully. Suppose you bought a lottery ticket and first prize 2 crores and you won that first prize. So that is fortune. Now suddenly you have 2 crores. Now that one, some of your close friends or distant friends, some of your close relatives or distant relatives, now they may approach you asking for financial help. Hey, my daughter's wedding. I like you to give me 5 lakhs. And another person, my son, he wants to go for higher studies in Canada. Some say 15 lakhs. They approach you. Like that, many people may approach you. They will see that, okay, you got that money, just like that. So why can't you share that money with me? Now the question, Abaji and Rajeshwari ji, will you give the money just like that? Then in that case, put yes. If no, put yen, chat box. I want to see your response. I won't give. I won't give. No. Yes. No. Exactly. Then what happens? Now the positive side effect, yeah, you got money. Now you're happy. That is a gain. But now you will get more enemies. The friends, relatives, they will be angry, upset, and the relationship will be strained, and they will badmouth about you many places. Is this something real or unreal? What I am sharing is it real or true? If it is true, put T. So they will become enemies. So did you really want enemies in your life? No. Because enemies in life, it will make your life a hell. So that good fortune just brought the negative side effect, generated plenty of enemies. So I'm glad that you are agreeing, and this is a fact. So not just medicine. That's why I told you. This talk is not just about medicine. Every action. For example, webinar. I started giving webinars 3 years back. Do you know what happened? Some people, totally strangers, I have never seen them face to face. And one lady, she is from the northern part of Kerala. Then she subsequently sends a WhatsApp message asking for 2 lakhs to help her. She wants to find a job in the Middle East, and she will go and get a job. Then she will repay. I haven't even seen her. And another guy from Kochi, he contacted me saying that he is not economically well off, and is that laptop, old one, now it is not working. So he wants to buy a new laptop. He wants a financial help from me. So all I did was my action. I'm giving free webinars. Now the negative side effect, again, people want money from me. And obviously they'll be upset and angry. You get it? So every action will have a side effect. APJ Abdul Kalam's words, truth is like a surgery. It hurts, but it heals. A lie is like a painkiller. It gives instant relief, but has side effects forever. Agree? If you agree, put A. Yes, sir. Thank you. Abba Keterpal. If you agree, put A. Yes, agreed. Thank you. Because I have spent a lot of time to hunt and collect these quotations. I have to hunt. Hunting, it takes a lot of time and energy. Eh? Side effects of a situation or an event. Outcome of examination or interview. Real life examples. Suppose the NEET result comes after the examination, or JEE. Passed in the top in the rank list. That student, parents, they will all be excited, thrilled. The side effect of that situation or outcome, positive. Suppose failed, depression, anger. And we know many teenagers, they commit suicide. And sometimes their parents also commit suicide. Is it true, what I am sharing? If it is true, put T. If it is not true, put F. In Rajasthan Kota, every year, 30 to 40 teenagers, they commit suicide in one place. In entire India, will be easily hundreds of people. That is what side effect. And in that context, I would like to share my own experience. I told you my own experience. MD examination. I'm sure that Dr. Mohanlal and Dr. Shaji Prabharan, they'll be able to validate this one. I'm talking about 40 years, more than 40 years back. That was in 1979. That time, passing the MD examination in the first attempt is a very, very difficult task. If 13 students appear, Only some 2 or 3, they pass in the first attempt. So when I was appearing, I was not a very hard-working student. I have no problem admitting the fact. There are some 3 or 4 students always very hardworking. They don't have any other work-life balance, no other hobbies. Hospital, library, hospital, library. And everybody expected them to pass in the first attempt. I also didn't have any expectation that I will pass the examination in the first attempt. What happened? Then I went for the exam. Those brilliant, hardworking students, they failed. And I passed in the first attempt. Then what happened? Side effect? I couldn't believe it. So excited, happiness. I couldn't get sleep for the next 3 days. So that is a side effect. I couldn't get sleep. The same way when I went to UK for MRCP examination, that's also very challenging, tough. The pass percentage is very, very low. There also I went there prepared. Yeah, I may have to take the exam 2 or 3 times. That's my approach. I don't go there. I must pass. Then there'll be frustration. That examination also, I passed in the first attempt. There also, I couldn't sleep for 2 or 3 days. Is it interesting? If it is interesting, put I in the chat box. This is my own personal life story. Oh, thank you, Ramaji, Aishwariji. Because I'm not ashamed. I'm telling the fact because I never expected. I never thought that I would pass. I couldn't sleep for 2 or 3 days. The same way interview also. For want of time, I'm not sharing some of my personal life experience. Marriage. Okay, arranged marriage. That is very common in India. Okay, the girl, boy, the girl's parents will look for somebody, boy, from a rich family, a good job and everything, and whatever it is, some transactions, dowry or whatever. Then after the marriage, that guy may be having a job. I'm giving you a real life example. A software engineer working for either Infosys or TCS or some other company, drawing the salary of some 50,000 or 1 lakh rupee per month. That guy subsequently gets into bad habit of gambling. And the gambling then lot of debt. Now he will ask his wife to get money from her father. So now this father-in-law, he finds that is okay, demand for more money, which he may not be able to give, or there won't be any end, because that guy's that habit, gambling. Then what happens? He will torture his wife. So the life becomes, instead of becoming a heaven, you marry thinking that the life will be joyful, peaceful, a heaven. Now it has become a hell. So that is a side effect of that marriage, negative. So not every marriage will have a positive, this one. Do you agree? These are all real life examples. If you agree, put A in the chat box. So this is side effect. Okay, Ramadevi ji, thank you. So these are all real life examples. Then promotion and transfer. Okay, a guy who has been working as a clerk in the SBT or SBI or Canara Bank, and he is in Bangalore or he is in Trivandrum, and he writes the officer's examination test, he passes, and then he'll be promoted and he'll be transferred to Bihar or Punjab. And he is here taking care of his elderly parents who have got some significant health problems. Now it will be dislocation. He'll have to go to Bihar or Punjab. And he'll be always worrying about what about my parents, this one health, and parents also will worry, okay, who will take care of me, he is away, far away, like that. So that promotion, that one brings positive, that is happiness, but negative also. So these are the things every day happening. Then lifestyle. Yeah. Most of the health problems and unhappiness in life is because of lifestyle. So lifestyle also will have a side effect, either positive or negative. A guy that is how he likes junk food and drinking alcohol and no exercise. Yeah, soon you will be what you call a patient with a bunch of medical problems. These are all the side effects. This is a vast topic. Actually, I can give a talk for 10 or 15 hours. So this is just to stimulate your interest and curiosity. Any doctor will admit that any drug can have side effects and that writing a prescription involves weighing the potential benefits against the risk. There is no medicine under the sun which is free from side effects. Even I gave a talk on hypovitaminosis and hypervitaminosis. Vitamins again, overdosing will have side effects. And many people, they take more vitamins unnecessarily. And they get the side effects of the vitamins, and then they see a doctor, and the doctor also won't know that is this symptom. Headache also, vitamin A excess can give you headache. The doctor will do all this CT scan, MRI scan, everything is negative. Then what will happen? They will give a pain medication, and that pain medication will have its own side effect. And the main thing, stop that vitamins. So watching the diet. Watch my YouTube, that one video on hypovitaminosis and hypervitaminosis, my dear friends. You will learn a lot about what should be done and what should not be done. Drug interaction, drug to drug, drug to food, drug to disease, drug to drug. For example, if I take, if I'm taking, or if you are taking a blood pressure medication, you're on blood pressure to control the blood pressure. And if you take a painkiller like ibuprofen, somebody has unmuted, there's a disturbance. I don't know who that person is. Could that person please turn off your microphone? I don't know who that person is. Krishna Arjunan, please turn off your microphone. Arjunan, I'm going to mute all participants. Okay. Now, so that blood pressure pill and taking this pain medication, you go to a pharmacy, medical store, you take that medicine without any prescription, it is easily available. Then what happens? Then this will reduce the efficacy of that medication. Your blood pressure will go up. Many people don't realize that one. Real life example. So drug to drug interaction. Drug to food interaction. For example, ant tablet. For anemia, the ant tablet should not be taken with food. It should not be taken with milk or tea. Then that will interfere with the absorption. Many people are not aware. Doctors, they don't have the time to explain all these side effects. Whereas in USA, in the pharmacy, the pharmacists, they will give a fact sheet along with the prescription. That will tell about what are the things you should not do and everything. But that's not happening in India. So food to drug interaction. Then the third one is food to disease interaction. That is drug to disease. For example, people with asthma. Some people with asthma, not everybody. I told you, the side effects may vary from person to person. People with asthma, they take aspirin that can make the asthma worse. So drug to disease. So far, is everything clear? Are you able to follow me clearly? If it is clear, in the chat box put C. Because I want to make sure that I'm using layman's language. Thank you, Roy Cherianji. I am using layman's language so that it should be crystal clear. Okay, Abaji, thank you. Commonly experienced side effects, abdominal pain, very common. Loss of appetite, constipation. Oh, my friend, now in the last 1 week, I talk to him almost every day. He was started on a new medicine for the irregular heartbeat. Amiodarone. Now he's having severe constipation. Severe constipation means he said that, hey, should I stop this medicine? Because the constipation is so severe. Obviously, the heartbeat, that is irregular heartbeat, he has to take that medication. So for the constipation, I gave him some other suggestions what to do. Increase the fiber intake and drink more fluids like that. So constipation is a very common problem. Diarrhea, for diabetes, metformin is a commonly used drug that can cause diarrhea for some people. Antibiotics that can cause diarrhea. Many people, they go to the medical shop and they, after consulting Dr. Google, then self-medication. In India, you can get an antibiotic without any prescription. But I think that now the government has changed some rules. I don't know how far it is going to be successful. Whereas in USA, I cannot get an antibiotic without a prescription from some other doctor. So because of that, when people develop diarrhea, then all the complications, elderly people, diarrhea, they may lose their sodium, and that may alter their alertness. These are real. My dear friends, please, please, please take home message. Don't consult Dr. Google and do a self-diagnosis and take self-medication. And some people, they go to the drugstore and the pharmacy and ask that guy who is selling. He may be having a 10th grader. I am having, and he becomes the doctor. And he gives a medicine. And you won't know that this person has got high blood pressure. And when he gives that medicine, this person will be saying that I am saving money. To see a doctor, I will have to consult some 200 rupees and all those things. I go to the medical store, I saved a lot of money. No. Now your blood pressure control is screwed, and you may develop other complications, and then you will end up spending thousands of rupees. Dizziness and fall, hip fracture and everything, headaches. Yeah, some medications, they can give headaches. Some antidepressants, they can give severe headaches. Then blurred vision. Viagra, for some people, it can cause the blurred vision. And there are other antidepressants also, blurring of the vision. Palpitation, rapid heartbeat, and especially some cough syrup, which has got ephedrine, that can increase the heartbeat. Some allergy pill, tablets you take over the counter for the cold, common cold, can make the heartbeat faster. Tinnitus, ringing in the ears, skin rashes, fainting, swelling of the feet. I will come to that point later. Erectile dysfunction, again, I'm going to talk in detail. So far, everything clear? Do you understand? If you understand, then put yes. Because I want to make this not for my enjoyment. I am trying to enlighten you and empower you. Yeah. Rajeshri ji, Roy Chirian. Because these topics, you rarely hear any doctors talking about that one. And when you don't hear, then what happens? You'll be ignorant. That ignorance costs a lot. And cognitive changes. Aspirin interaction, aspirin and peptic ulcer. People with acidity and those symptoms, if they take aspirin, that will make it worse. And sometimes they may start bleeding also. Aspirin and alcohol. Oh, many people in India, they are on low dose of aspirin. But you watch how much alcohol you drink. But they just booze, 3, 4 pegs. Then that interaction is dangerous. Benadryl. Have you ever used Benadryl? If you have used it, put in the chat box. Yes. Why? I want to know how many people have used Benadryl as a cough syrup, or how many people are aware that most of these allergy medications have Benadryl. Rama Deviji, no. What about others? Anybody? Benadryl, no. Android, okay. No, okay. I'm surprised because Benadryl is a commonly misused drug in USA. In any pharmacy, over the counter, no prescription. Benadryl, no, okay. In that case, I'm not going to go into the details of that one because you are not using, so you don't have to worry. Because this Benadryl can cause drowsiness and sleepiness, side effect dizziness, dryness of mouth, constipation, headache, and dermatitis. And in India also, I'm sure there are some skin creams, allergy cream. They have Benadryl. The ingredient is a diphenhydramine, the generic name. And that can cause worsening of that itching and everything. So antihistamine applied topically is not safe, is not good. So these are some skin rashes. I'm giving you one example of a skin rash. And I told you about the swelling of the look at the comparison. This is a normal leg, this is a leg with a swelling. One of the blood pressure pill called amlodipine, that one can cause swelling of the feet. And if the doctor, you may be seeing many doctors, you may be seeing Dr. X today, and you may be going to Dr. Y today, tomorrow, and this doctor has prescribed amlodipine, you may be taking this medication, and you don't take the prescription with you, and the Y doctor, he won't know that swelling is because of the side effect, and he may now prescribe something else. The right thing to do is stop that medication and give a different blood pressure medication. These are all things happening. In US also it is happening. Erectile dysfunction causing drugs. A good number of drugs, they can cause sexual, dysfunction. And it is a biological necessity. And sexual dysfunction or erectile dysfunction can lead to lot of unhappiness, marital conflict. And many people, they feel ashamed. They don't tell this to the doctor. They don't discuss that one. Depression medications. Some common examples. And a person taking the depression medication, now he is not able to get a good erection. Now, do you think that depression will become worse or better? If it becomes worse, put in the chat box W. I want to know. Because for depression, it will become worse. Worse. Thank you, Dr. Yanji. Worse. Blood pressure medication again. Not every medication. Some blood pressure medications like metoprolol, which is commonly used, that can also cause erectile dysfunction. Allergy pills, I told you, Benadryl and other pills. Painkillers, again. Acidity blockers, acid problem. That is ranitidine, famotidine. Then muscle relaxants. Because you go to pain in the muscle or fall trauma or something like muscle spasm, and they give you a muscle relaxant. Yes, that spasm is gone. Now you are not able to get erection. Erectile dysfunction caused by recreational drugs, alcohol, marijuana, opiates, cocaine, nicotine. Positive side effects. Finasteride. This is a tablet usually prescribed for prostate enlargement. That one, they found that is unintended positive side effect. It helps in hair growth. So now they are marketing it for baldness also. Okay, if you have got a prostate enlargement and you are bald, okay, you take this pill, okay, now hair may grow. Okay, that is a positive, this one. Including even the Trump was supposed to be taking that tablet. It appeared some 6 years back. He is on that pill for his prostate problem. And that may explain that he is having rich hair also. He is not bald. Minoxidil, a blood pressure medication, again, help in hair growth. Steroids. Steroid medication, that can give you a sense of euphoria. You feel good. Euphoria is a positive, this one. And the people with asthma, some people, they immediately give this steroid, they feel good. They are happy. But it is a side effect of that steroid. That is one way of getting the patient back. So they become a regular patient. And the steroid abuse, that can lead to skin rashes, weight gain, diabetes, blood pressure problem, everything. There are doctors who are unethical, my dear friends. I'm a medical doctor. It's a fact. There are unethical doctors. Caffeine, again, euphoria. That is why it is very, very popular. These Pepsi, Coke, energy drinks, they have caffeine, mood elevator. And the caffeine can again make the heartbeat faster, heart problems and many things. And it will interfere with your sleep. If you drink Coke, say around, if you want to go to bed around, say 9:30, if you drink some Coke around 9 o'clock, you may not get sleep. Many people don't realize that one. Always get answers to 7 questions about new drugs. See, after this talk, my dear friends, I'll be uploading the video. Watch the video again. And these 7 questions, you must try to find answers before you, whenever a new medication is prescribed for you. If you want to prevent and protect yourself, I told you, the purpose of this talk is to prevent or protect you from some side effects. What are the common side effects of this drug? You have to ask the doctor, or you have to ask the pharmacist. But unfortunately, in India, most of the pharmacists are not educated or qualified to answer. How soon will the side effects start? Some start within hours. Some start after maybe 1 week. How long do the side effects last? Some side effects may last as long as you continue the medication. Whereas some side effects, they stop after a couple of weeks. For example, the metformin, diabetes pill, it can produce abdominal pain, distension, gas, and loss of appetite and everything. But after 2 or 3 weeks, if you continue the same medication, it will go away. Nitroglycerin, give you headache. That also continue after 2 or 3 weeks, it will go away. Will the side effects go away by themselves? I explained. How can I prevent the side effects? I told you. Certain medications should not be taken on empty stomach. Are there any dangerous side effects? Then what should I do if I have a side effect? We have a pharmacy inside us that is absolutely exquisite. It makes the right medicine for the precise time for the right target organ with no side effects. Example is laughter. The only medicine without any side effects. Laughter, genuine laughter, not this laughter yoga. That is nonsense. Laughter yoga, ha 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 ha, ha 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 ha. No. Real humor. If you watch some comedy in Malayalam, the Jagadish Srikumar or Innocent or Srinivasan, and you will laugh, that will generate dopamine, oxytocin, endorphin. That's a painkiller. And not only that, it will give good sleep. So laugh. Learn to laugh. Young kids, they laugh a lot. That's why they sleep. A 2-year-old baby won't sit and worry. It sleeps like for 10 hours or 12 hours. Laugh. Laughter is medicine without side effects. Okay, upcoming talks every Thursday, just like today, I give my talk. Next one is art of delegation. If you learn the art of delegation, you won't say I am busy, busy, busy. People are so busy because they don't know. They don't delegate. Awesome and awful parenting. So that is my Zoom link. You can take a screenshot or subsequently you watch the video and get that one. Thank you for your intellectual curiosity. Any questions, any comments? We have roughly 10 minutes. Only questions now. If you want to share your own experience, you are welcome, but after 9 o'clock. So till 9, only questions. Yes. If you raise your hand, then I will call you. Okay, Shaji, go ahead.
What are the doctor side effects to society?
What is it?
What are the doctor side effects to society?
I know you are a doctor. Tell me. You know the answer. So I don't know what answer you are expecting from me.
No. Many patients have lot of side effects towards doctors.
Side effects towards doctor, you are talking about practicing medicine has got side effects. Practicing medicine, the side effect is in Kerala, Adi, one partially varuvarunnu, ipo Adi appodu thenne kittum. If the patient dies or something happens, then the side effect of being choosing that profession is immediate beating. Roy, am I right? Roy, am I right? Yeah. So because of that, the medical profession has become a high-risk profession. If you are in the army, only the Indo-Pak war, then you have to worry about that one. Here, every day you have to worry about getting a good BT. And recently, you know, Vandana Das, she was stabbed to death. She was killed by a patient. So, drinking alcohol is dangerous to health. So, choosing medical profession is also dangerous to health. Okay? So, think carefully, especially in India. In America, also dangerous. It's dangerous because in my previous talks I gave, I was subjected to discrimination, harassment. They fabricated complaints. They solicited complaints against me. And I had to fight legal cases, 5 legal cases, 7 years. And by God's grace, eventually I was able to convince and persuade the judge and jury to give a verdict in my favor. Otherwise, forget about it. Everything. They can easily ruin the career of a doctor in USA or a nurse, not the life of a software engineer. Okay. Okay, Jaychandra ji, you want to say something? I can hear your lip movement. But unmute, yeah.
In Trivandrum, doctor, you know that we have Chiri Club and the Narmagairali clubs. There we have treatment without any side effect, any reaction. It is very, very good for mental and physically for us. You know the mode of action.
And you know that I used to be a stand-up comic. I used to, when I was there for that 5.5 years, 66 months, every month, I used to come and do a stand-up comedy for 20 minutes using the PowerPoint. That also, nobody used to use a PowerPoint for that one. And I was also that in AsiaNet, I'm sure that some of you must have seen that 12 years back, that is the Nammal Tamil program that was hosted at that time by Ganesh Kumar, the current minister. He was hosting that one. And I was one of the...
I heard it.
Yeah, I cracked some jokes and that has become viral after 10 years. It became viral. And at least some 10 or 12 people, they forwarded that one to me. And they asked me, is it you? Because you look very young. So when was this recorded? So I am a person, sense of humor. I see humor in everything. You can, if you want to, depending upon. Humor is there. And watch the comedy strips. Don't watch the TV debates. Don't watch TV news. That is not good for health. TV news, a lot of negativity. And that can affect your even thinking also. For example, this happened, a real story. In 2008, I came to India on a 1-month vacation. That is in August. On August 15th, my father, as usual, went for a walk. In the morning, he usually goes for a walk around between 7 and 7:15, and he walks for 45 minutes. Then he comes home. And that day, till 8:30, he didn't come back. So my mother told me, hey, your father, he is not back. Okay, what would you think, Yachandranji? Immediately, he is at that time 83 years old or 84 years old. So my brother, okay, did he fall, faint or anything of the age or all those things, or on when he was walking, did some vehicle come and hit him? That is what my line of thinking. Then I immediately called the 3 or 4 hospitals. One in Trivandrum itself, that Jubilee Mission Hospital, then General Hospital, then GG Hospital, and Medical College Hospital, Casualty, and also, did anybody bring an old man, some 80 plus? They said no. Everywhere negative. No. I'll explain that one.
Okay.
So it went on. Then what happened? I saw my mother. What did she do? Because of all these TV serials, influence. She asked our shop Good Morning Show's employees to go and find out whether somebody had kidnapped my father. Somebody had kidnapped my father, a car and everything. So they were looking for a kidnap, because in the TV serials they are saying kidnapping the kids and other people. So the whole thinking is also screwed. The influence of the TV, that one. I told her, what? Kidnapping father, wife? You don't know. These things are happening I see in the serial many things. Then my father, we couldn't locate him. After 10:30, he came home. Okay. So then I was there. I asked him, what happened? You were away for time. He's that August 15th at the Central Stadium. That is behind the Secretariat. They were having that August 15th flag hosting that ceremony. And Achyutanandam was the chief minister at that time. So he went to just attend. Then once you are inside, they wouldn't let you go out till the ceremony is over. So it was something like that. He could not leave, and he didn't have any cell phone or any of those things. So he was there for nearly 2.5 hours in that August 15th, that one. So this is a real life incident. So my dear friends, stop wasting your time watching these TV serials, all these political debates, and this guy CPM, and this guy Congress, this guy BJP. Yeah. What we'll do? It's waste of time. I don't watch TV news, but I read online newspapers, and I can choose what I want to read and how much time I should want to spend that one. Whereas the TV news, no, you are under their control. They decide what to. And in that process, they'll put many ads also. Ads like jewelry and all those things. Then that will, okay, the ladies will think of, okay, I should go to the Bima and I should get this necklace. And that will create a side effect. Okay, and her husband won't be having that much of money and she wants that jewelry. And if you don't get that one, she'll be unhappy. Then if it's a government job, then corruption rate will increase. He'll say, instead of 500 rupees, he will want 1,000 rupees. That is a funding for his wife's wants. Okay, these are all the things, side effect of all this watching the TV commercial. Okay, so did you all find this session really useful and informative? If it is really useful for you, because I want to make sure whether I have really empowered you, Musamilu, empowered you with an information and facts which you won't get easily from anybody else. Okay. I'm going to stop the recording. Don't go away. Just stop the recording and then we will continue the discussion. I'll be able to share more information, because if the recording lasts for more than 60 minutes, many people will be discouraged. So that is why.
Yes, at all very correct.